All right, so what can go wrong? Well, cavities and root canals. So depending on, well, a cavity will form where there's bacteria kind of not being either brushed away or flossed away. So it'll just depend on where that pocket of bacteria is as to where the cavity will start to form. But basically it starts usually with a plaque. And when you don't clean that plaque off your teeth, the bacteria, again, they're good at finding things to feed off of. And then they are secreting a acidic secretion, which then breaks down the enamel, causing these pits, right? So again, the acids and bacteria will remove minerals, and then once areas of the enamel are worn away, they can reach to the next layer called the dentin, right? And then again, this is softer layer than the enamel, and that's one of the things that may make your teeth sensitive or may make it hurt when you have a cavity, depending on how big that is. And then if you don't take care of it in a timely manner, it can continue into the pulp cavity, and that's where you have nerves and blood vessels. If that becomes swollen, that can be very bad and very painful. And then what ends up happening, you can kind of see in this image here, when that happens, what they'll need to do is they need to drill a hole, kind of come in here, take out all that pulp, fill it with this, like, what do they call it, like a plugger, and then cap it and put a crown in, right? So make sure you take care of your teeth. Root canals are not fun. I mentioned this to you at least a little bit. Sometimes there's bacteria in the food that you eat, which will irritate the epithelial lining and will trigger the muscularis layer to either move food out of your body pretty quickly, and that is vomiting. That is controlled by the medulla, so it is not a higher brain function. You actually do not have to be conscious or awake to vomit. And that can be very dangerous. That's why they'll tell people who've had a concussion or if they've passed out due to drinking, do not let people sleep on their backs, because if they do and they vomit, they can aspirate very easily. Similarly, if someone who's had a concussion, sometimes hours after the injury, it may trigger a vomit response. And again, if they're sleeping on their backs, they could aspirate very easily. So they'll tell you sometimes like roll them over onto their side, or even sort of with their face kind of over the edge of the bed. So basically what happens when you vomit, there's the retching, sort of that, that first initial kind of feeling like, oh, it's coming, right? So what's happening is the lower esophageal sphincter is going to relax, and then the stomach and the duodenum contract with such force that it basically propels food up and out. And then that's basically vomiting. You can watch a couple of videos here. They're basically x-rays, videos of a dog who's swallowed rat poison, and you'll actually see the motility of the intestines and the stomach and how food gets moved along to, well, go back out the other way, okay? Okay, you may have heard of GERD, or gastroesophageal reflux disease. There could be a couple of different, I guess, types. Sometimes this sphincter does not want to open, so you swallowed food and it just kind of sits here on top of the diaphragm. And just as a quick little reminder of anatomy, right behind this area, just about in here is where your heart is. So it can feel like when there's food here and there's like this extensive stretching of the esophagus, and then, there's sort of this weight in that area, it can push on the heart, and it can even feel like chest pain or a heart attack. It can be very scary, right? Sometimes even gas can feel that way. If this lower esophageal sphincter fails to close, so if this stays open, well, now it's open, which allows acids back up into the esophagus, which does not have that nice thick mucus lining like the stomach. So that causes ulcers to form in the esophagus. It can be very painful. That's what heartburn is, depending on how much acid is getting up in there. It can just be like heartburn. And again, it's called that because it's a burning sensation near your heart, right? So there's different things that people can take or do to help control this. For one, don't eat a large meal. So the bigger the meal, the more acid and the more kind of like upward pressure that's being produced. Don't lay down, right? As if you stay upright, simple gravity will keep food away and acid away from this esophageal sphincter. If you lay down, right, acid will kind of pool up toward it. You can see that smoking and alcohol can make the sphincter relax. So again, that can worsen symptoms if you happen to have them. Other things can irritate can promote acidity. So things like coffee, chocolate, tomatoes, fatty foods, onions, mint. All of these things can further irritate the stomach and cause more acid production. There are other over-the-counter medicines that you can take. So Tagamet or Pepcid before eating. Basically, those will downregulate the amount of acid that your stomach is producing. Or you can simply neutralize the stomach acid with something like Tums. Now, Dr. Barry Marshall, this guy, and Dr. Robin Warren got the Nobel Prize back in 2005. So gosh, that's about 20 years ago now. By proving that H. pylori, or Helicobacter pylori, causes ulcers. This may seem very obvious to us now, but it wasn't, right? For a long time, the prevalent thought was that stress caused you to produce more stomach acid, and that's what caused an ulcer. And what they learned was that this H. pylori will drill into that mucus, destroying the mucus-producing cells. So by eroding that mucus lining, then the stomach acids will actually start eating away at the actual tissue of the stomach, right? You can see that in this image. And I'll tell you just a quick story. This is kind of a cool little fun fact. The way that this was proven beyond a shadow of a doubt was Dr. Barry Marshall here. He had been saying that H. pylori were the cause of ulcers for many years, right? And his research showed that. But again, he was like one guy trying to sway the scientific community, and everyone else knew better. And no one really wanted to listen to him. And one of the reasons why is because we all have H. pylori levels. So if H. pylori was the culprit, then everyone would have ulcers, right? But we don't. So the thought was, well, it can't be H. pylori. So he was so frustrated one day. He had like a beaker full of H. pylori that he had cultured. And he literally like swallowed it. He's like, I'm going to prove it to them. I don't have an ulcer now. I'm going to drink this. I'm going to introduce all this H. pylori in like a week's time or so. I'm going to have an ulcer and that'll prove it. Well, it did not take that long. It only took like a few hours and he was bent over in pain and his wife found him and had to take him to the hospital. I can only imagine what that conversation was like. Because I'm pretty sure you're not supposed to, that's not proper scientific protocol. But by doing that stunt, he very clearly proved that what happens in an ulcer is these H. pylori levels, or H. pylori bacteria, their levels get out of control to the extent where they actually cause damage, right? So anyway, now ulcers are somewhat easier to treat if caught early on. You can take antibiotics, get those H. pylori levels back down, the cells regenerate, and watch what you eat. You try to stay away from acidic foods, and then your stomach can heal itself, as long as it hasn't gotten too bad and you need surgery. Things can go bad in the gallbladder. Remember, the gallbladder concentrates bile. Sometimes it overdoes its job to where it forms bile into these little pellets or stones. Unfortunately, it is very difficult to pass a hard stone. Sometimes they'll get lodged in that cystic duct or that common hepatic duct, or even at that juncture with the pancreatic duct, which causes a backup of bile. Which can then cause inflammation in either the gallbladder, it can cause inflammation in the liver, it can even cause inflammation in the pancreas, depending on where the blockage is. And oftentimes what they do is they just go in, and it's now like a laparoscopic surgery. They remove the gallbladder, double check to make sure there isn't a gallstone somewhere else in the system, and it's a fairly routine surgery. Oh, so many things can go wrong with the liver. So what you're looking at here, I'm just going to move this down just a little bit. So this is a real life liver that has cirrhosis. The surface of the liver should be nice and smooth. It should not have all of these like bubbly lumps on it. Those are major fatty deposits that have formed. This is scar tissue. With all of that, the liver can't do its job, so you're no longer detoxifying your body. You're no longer producing a whole series of enzymes. If you go back, remember the liver did so many things for our bodies. It can no longer function. So unfortunately, people who have advanced cirrhosis either need a liver transplant or frankly, they're very sick until they pass away. Another thing that can go wrong with the liver is hepatitis. So this is simply an inflammation of the liver. It can either sort of heal itself depending on how bad it is, or it can produce some very bad scarring. It can produce cirrhosis. It can even advance to liver cancer. So hepatitis, again, by itself is just inflammation of the liver, but depending on what the causes might be, it can be more or less serious. You don't need to memorize all of the rest of this, all the different types of hepatitis viruses. This is just there for your information. You should know, however, that one of the hallmarks of hepatitis, or especially acute infection, acute infection may have limited or no symptoms, but the classic sign of hepatitis or something going wrong with the liver is jaundice, right? And jaundice, that definition is the yellowing of the skin and the eyes. Dark urine, and I don't mean like a dark yellow, like almost orangey brown, kind of like rusty color urine. You see that there's a problem with the liver. Definitely go get checked out. Extreme fatigue, nausea, vomiting, abdominal pain, all those things, go get checked out. We talked a little bit about the appendix not that long ago. So again, here's our little normal appendix. Here it is inflamed. If this ruptures, why it is so deadly is that it can lead to peritonitis or inflammation of the peritoneum in the abdominal cavity. Because it is highly vascularized in this region, right, to help you absorb food and nutrients, bacteria can get into the bloodstream very quickly and you can go septic very, very quickly. So they, if you've got like an inflamed appendix, I mean, that's like emergency surgery. Like that's it. They're taking you in because you cannot survive a burst appendix. Amazing how such a little organ going wrong can have such deadly effects. You may have heard of colostomies or a colostomy bag. So depending on where the problem is in the large intestine is where you would put the colostomy bag. One of the classic locations is sort of in this lower mid-left area, the abdominal, of the abdomen rather. So the names are just where they're located, right? So it's a transverse colostomy or ascending or descending sigmoid colostomy. It's just that portion of the large intestine where they've had to remove and put the colostomy bag. The stoma is basically it's basically a portion of the intestine that's actually poking out of the abdominal wall where the bag is then attached to. Okay, so it's kind of like that port that's going to attach the intestine to that bag, right? Ever so often, you may have an ileostomy. It's the same concept. In this case, the problem is further up than the large intestine, so you actually have to put the stoma in at the level of the ileum. All right, so this last bit is more kind of fun stuff as we talk about digestive systems. So you won't be tested on this. Again, it's just more for fun. Animals are fantastic comparative anatomy subjects because they have such varied and specialized diets that their digestive tracts then have to be very specialized. Now, this first one is this animal. It's a tree shrew, And I don't know how we can see this, but this is a pitcher plant. That is the lid of the pitcher plant, normally be closed. That pitcher plant lid opens up. There is a sweet, sticky kind of substance on the surface that these tree shrews absolutely love to eat. They will lick that, and as they are licking that, they end up pooing into the pitcher plant, and the pitcher plant digests their poo. And that's where it gets its nutrients from. And it's evolved to be very specific to these animals. I think that is just absolutely fantastic. Just a little bit about cecums. Again, our cecum is very small. It's not a very large organ at all. If you look at the cecum of a horse, however, it is much larger. So if you look here, so here's the stomach, you'll notice that it actually has this really odd shaped like duodenum, going in, like kind of curves around this way, ileum into the cecum, odd little intestine colon structure. That's because horses eat lots of grass, right? So they have a digestive system that has more bacteria to help break down some of that grass and absorb the nutrients from what the bacteria have broken down. Hopefully that made sense to you. Now the downside of this is all that bacterial fermentation and digestion is occurring in the large intestine. Similar to us, there's less absorption occurring in the large intestine than in the small intestine, and there's less time to break down foods. And this is why, like, if you ever look at horse poop, it looks not that different. It looks like digested hay. You can actually still identify what it ate, right? So anyway, so that little fun fact for you. And then animals, like this is a giant, I think it's a Welsh Rex rabbit. This particular unit here is going to have a very large cecum, and they actually have a interesting mechanism where you may have heard about this or maybe haven't, but rabbits will often eat, and certain other rodents will eat their own feces. And just a quick backup, rabbits are technically not rodents, they are lagomorphs, but rabbits and certain rodents will sometimes eat their feces. But what they're doing is, like, the very first time some of the plant material goes through, again, they are hindgut fermenters, similar to horses, so that when they poo out the little pellet, it actually hasn't been fully digested yet, and there's still some bacteria in there breaking down the plant material. So they'll digest that, they'll ingest that a second time, so that now it has the opportunity to go through the small intestine and also absorb even more nutrients. Which I think, it's gross, right? But at the same time, it's pretty ingenious when you think about it. That's how these animals have to survive on just plant material, right? Then we get into things like cows that have 4 portions to their stomach. They actually have this can you see this large chamber right here? So you'll see, like, okay, food goes in, follow this green line, it goes into this giant chamber, it comes to this area, it then goes back up into the mouth, right? Sometimes you've heard of cows chewing their cud. It then gets swallowed back down, goes into this other chamber before it actually ever goes out into the intestines and then, out of the body. This large chamber, this is basically a giant vat of microbes and bacteria that are helping break down plant material. And then when the cow kind of regurgitates that and chews it again, it's adding more, nutrients into it via its saliva, and then it swallows it again. So by the time it gets to the small intestine, it's really, really well broken down. So the cow can actually absorb quite a bit of material, quite a bit of nutrients from grass. And if you, I don't know how familiar you are with cow poo, but they're kind of like splat patties. Like, that grass has been fully digested. There's no recognizable plant material in it. This image here is an image of a vampire bat. So this tube right here, so vampire bats, first of all, right? They subsist on the blood of other animals. So this is the esophagus. Check out this crazy looking stomach. That's the stomach. It's this long, like, kind of, long, squirrely kind of looking organ. It almost looks like an intestine. That's because it's got to ingest a lot of fluid, right? A lot of blood. And it's really, really good at absorbing water through its stomach so that it can quickly like pack down the nutrients and the red blood cells and get rid of any excess water, right? Because the last thing a bat, a little flying mammal, wants to do is bloat up like a tick, because it would never be able to fly, right? And then its intestine is very simple and specialized to, again, continue to break down of red blood cells and any other material that may be in the blood that it is drank. Lastly here, this is going to be the stomach of a, in this case, I think it's of a chicken, or maybe a pigeon. I'm not exactly sure now what image I used. But their stomachs are two-part. There's a first part that is glandular, so you have lots of digestive enzymes. And then this part, which is the actual gizzard, is incredibly strong. And if you ever open up a gizzard, you'll, like, if you get the opportunity at Thanksgiving time, like, take the gizzard, you know, it's usually in that Paco stuff that's in the bird. Try to cut it open. That thing is super dense muscle. And then the inner lining, there's a cuticle. It almost feels like, I would say kind of like your fingernail, maybe even like thicker and tougher than that. And birds will swallow small pebbles, depending on the size of the bird, right? Or rocks for larger birds. And that gizzard will actually crush up seeds, plant material, depending on the bird, other bugs, whatever that the bird's diet is. It's absolutely fascinating. Like, I'll just give you this one last quick thing. Like, vultures have such powerful gizzards. They're actually able to pulverize metal. I find that mind-boggling, right? I mean, and they'll swallow like whole bones too, and they'll just pulverize that. They're able to like crush it down to such tiny, tiny little powder that they're able to get nutrients out of it. Simply amazing. Okay. I've talked long enough. If you have any questions about this section, please let me know.